Welcome to Take a Moment with NCHC, with me, Miranda Gretton, the show where we take a moment to delve into the hot topics affecting our workforce, from compassion fatigue to dealing with stress, mental health to make-ahead meals for night shift workers. We'll talk to experts for tips and advice about the issues affecting you. Listen on your drive between patients or on your downtime, whenever you get the chance to take a moment. Due to the pandemic, we have had to record some of our podcast episodes remotely. As a result, the sound quality in this particular episode is affected. In today's episode, we're talking about men's mental health and how we can understand the challenges faced by our busy male colleagues. We're joined today by two guests, Ian Bell, Head of Learning Disabilities at NCHC, and Nick Little, founder of the 12th Man campaign. So firstly, welcome both. Thank you so much for joining me today. Tell us a bit about yourselves.
As you said, I'm the co-founder of the 12th Man campaign. My fellow founder sadly died a few years ago. The 12th Man campaign works with businesses and interest groups, and we offer funded, cost-free for those people, mental health first aid training, because those businesses and interest groups have been identified as places where men go or may have a high male workforce, and crucially that the conversation is integral to what they do, whether that's cutting someone's hair, whether it's riding in a cycling group.
Hey, my background is in mental health, so I trained as a mental health nurse back in the late 1990s, early 2000s, and remain a registered mental health nurse. So I've worked through mental health, I've worked in the acute hospital, and currently working in learning disability services. But I still have a real passion for mental health, and that's why I got involved very much with the 12th Man. I cycle, that's how I kind of got into contact, and hoping to do more work in the future with Nick and his campaign.
So Nick, some of the statistics on the 12th Man website around men and mental health are quite sobering. 2,083 men died of drug-related causes in England and Wales in 2019. 73% of people who go missing are men, and 5,019 men died of alcohol-related causes in the UK in 2020. So why do you think men tend not to discuss their mental health as freely as perhaps women do?
It's a really big question. I'm not sure I fully know the whole picture, or that anyone does, but it is a very relevant question, because that was really the starting point of the whole campaign back in 2014, where myself and Oz Osborne, my co-founder, we were commissioned by the Time to Change campaign, who we were working with at that point, to try and work out why men weren't engaging with that campaign as much as women were. And we had a fairly good idea, being men ourselves and men who worked in the field of mental health. But essentially, we never, in our personal time, went to any mental health events or did anything of that kind of nature. So we kind of focused really on that exact question. And we surveyed a few thousand people. Men don't talk about their mental health as much as they should, because they see it as a weakness, because other men don't talk about it, so they're not going to, because men don't know how to talk about it and maybe don't know what emotion it is that they're actually experiencing. There was a big range of other issues related to their work, worried about what's going to happen if they do go into work and disclose how they're feeling, and the stigma as well, the kind of perceived or actual stigma that people may have experienced. So all of those things together, I think, then combined with a kind of culture that is not by no means exclusive to the UK, but is certainly here, of men seeing any problems that they may encounter in their life as something that they need to be able to fix. But with mental health, we often can't fix it immediately, or sometimes can't fix it at all. We need to learn how to manage it.
Yeah, the stigma thing for me is very interesting, because a lot of it must be perceived, that people think that that's what people would think. But especially now, when we're talking so much more around mental health in general, children's mental health is a very big topic at the moment as well. So we are opening up about mental health in general a lot more than we ever used to. And yet those stigmas are still there. So it's, like you say, it's about changing that and helping people to understand why we can talk and it's okay.
Yeah, no, I agree with everything Nick said there. And I think that sort of unknowingly, and maybe it is changing, but unknowingly that language that gets used from a very, very young age, the different genders get different messages. And I think it's done so casually that people don't notice the language they're using about not being weak, being strong. So either directly or indirectly says, don't talk about it. You just need to get on and you'll be fine. I think that message starts very young, and I think it follows boys and young men and then into kind of adulthood. That makes it difficult. And like Nick says, it's been around for a long time. So you have to work over a long time to try and get that change and to try and get that message that there's nothing about weakness. In fact, it's probably more about strength to open up, and that we all can seek that support should we need it.
Well, Ian, you worked on our Men's Health Week 2021 recently, the Can Do Challenge, encouraging men to use 5 themes and try new things to improve mental and physical well-being. So just on that, what are some of the things that our busy male colleagues could get involved in?
So specifically within NCH&C, we are training more mental health first aiders that will be able to be identified and for people to speak to and approach, as well as people's kind of line managers. But I think what we want to do is kind of spread that culture. So you don't have to seek a specific person wearing a specific lanyard, but that culture starts to spread out. So you will have a high degree of confidence, and that risk becomes much less, that you know that if you speak to any other male colleague, if that's what you choose to do, that the response is going to be a positive one. It's not going to be a don't talk about this, man up, all that kind of language. But probably still exists. That's what I think we need to get to. But in the meantime, there will be people within your place, as we call them now, within NCH&C, within your service, or maybe even within your team, that you will be able to go and speak to if you are struggling, if you have got some kind of concerns. And through that work, hopefully that culture then spreads through the organisation.
And Nick, that's exactly what the 12th Man is about, isn't it? Encouraging that culture.
Absolutely. I was just going to say that sounds like a fantastic approach that you've got, and really mirrors our thinking that the way that we need to address this cultural issue is through a generation of work. It's not going to happen overnight. And that what we need to do is embed the idea that we all need to take some responsibility for our own mental health, but also the mental health of others, how our behaviour and conduct can impact on other people. That needs to be community wide. We have this idea that mental health or mental illness is something that happens to you when you become unwell. And at that point, you go to someone who fixes you, and you kind of remove yourself from whatever environment you may have been in. Sometimes it can mean your kind of social contacts, your friendship groups, and things change. And suddenly you're put into a situation where all the other people that you're with in a group or something are also people who have a mental illness or a mental health problem. It somehow defines people. And that can't be the case when we're saying that 1 in 4 people will experience a mental health problem at any given time. 1 in 6 people in a year will have a serious mental health problem. How can that be the case? If it's going to happen to everybody roughly every 4 years, why are our services and our kind of attitude towards it the kind of opposite? It doesn't affect you until it does, and when that happens, off you go to somewhere else. So in embedding this within your culture is absolutely, I think, the right way to go, and it's what we're trying to mirror within the wider community, really.
So how can we make the first steps to empowering somebody to speak up? At least, I suppose, knowing that you could just turn to your colleague who isn't trained but is your friend. You could turn to them and ask them, but what steps can we take within our organisation as colleagues?
Yeah, I think that's really interesting, because you're right. It's not just about the person who may be having an issue or some concerns talking. It's about all of us noticing. And that's not noticing in the kind of nosy Parker kind of way. Over time, you get a sense of how people normally are. And sometimes things can be slightly different, not hugely different. It doesn't mean someone comes into work and, they're sitting in a corner kind of crying. This might be they just seem a little distracted, or they might seem a little unkempt. They're just little subtle things. And I think often we don't notice, or we're not curious enough, and we don't want to pry. And I think there is a way of doing that, of noticing and having a gentle conversation, or picking a time so you're not in a crowded environment, and just say, are you okay? And maybe not always taking the kind of I'm fine as the answer. Finding that balance between kind of pushing someone where they may feel uncomfortable, but showing enough concern, but not leaving it there, because someone might say, no, I'm fine, But 2 or 3 days later, you still notice things aren't quite right. And it's okay to go back and say, are you sure? So I think that genuine, compassionate curiosity is what we need to encourage within our workforce, to really take care of each other. But it's about encouraging that environment where people feel cared for and people are interested in their well-being.
The 12th Man campaign is built on those kind of positive values of the football crowd, isn't it? So it's about saying to our colleagues, be that 12th man, be the person who comes and asks the questions, text your mates.
The reason we called it the 12th Man really is where we identified where men go and where do they show emotion. The football crowd came up a lot. So just 2 days after the Euro 2020 finals, there was a lot of emotion people have shown. And actually what's very interesting is when men show emotion in a football crowd, it's not just accepted, it's actually celebrated. It's the hardest man is the one who's crying, because for some reason that's perceived as he's more passionate than somebody who isn't crying. But then when we're looking outside of that context, it's a complete role reversal. So we thought the best thing to do would be to name our campaign after something that men already feel very positive about. They feel they have a role, but also that you make a lifelong commitment to your club, well, you should do anyway. It can be for very personal reasons. It might be that it's your local team. It might be that there's family connection. You might have been born somewhere and lived somewhere different. So there's some really deep-rooted stuff about people's identities that's kind of all caught up in this idea. So what we're trying to encourage is men to see that they have another team as well. And that's the men that they work with, their friendship groups, the men in their family, and that you can make that same lifelong commitment to those people. And that includes yourself. It includes regularly checking in and thinking about your own mental health, because we found that men will talk about mental health. We know that the cycling group that Ian's involved, all the kind of work that we've done with barbers, they absolutely will talk about it.
But if someone's really struggling, the thing that I will say to them is, do you want to go for a walk? And I don't say, oh, let's sit down and have a conversation, because it probably isn't going to work as well. And you drive out to the coast or wherever you're going to go and you walk alongside, and it might take a bit of time, but that conversation flows. And there is something about that distraction that makes it easier. It's not exclusive for men, but I think it helps. So whether that's walking or cycling, it does free up men, I think, to talk more openly.
The more you talk, the better you become at doing it. So we were talking earlier about the fear of the consequences. And certainly I've got this theory that a lot of men don't even know what the emotion is that they're experiencing. So it's all right telling everyone we need to talk. Everyone needs to talk. Well, firstly, you need to know how to listen and not sort of jump in with, oh, you want to try this, or, you know, the top trumps thing of, oh, that's nothing, mate. You know, this is what happened to me. So you have to learn how to do that. And our culture and society doesn't prepare men and boys to do this very well. So we definitely need to learn. We need to be trained. And that's good, though, because men love to learn a skill that they can then go off and use. And so it works. That's the first thing. But then about recognizing, well, what is the emotion that I'm feeling? Anger is often one that's brought up. Oh, I feel angry. Do you really feel angry? Is it actually anger, or is it something else that's presenting itself to the world as anger? But actually, there's something else happening. So the more we talk and the more we kind of listen, the better at it we'll become at both of those things. And also I mentioned the fear of the consequences that was a key kind of driver when we were doing our initial research. Well, if you think of Ian's example there, if that men have got this fear of the consequences and they're really worried about talking, but then they finally do, and they find that actually the consequences of their conversation are overwhelmingly positive. Somebody listened to them, validated their thoughts and feelings, supported them, empathized with them, and offered them, would you want to go for another walk in a week or two? And suddenly that fear of what might happen is being replaced by a really positive consequence. Right, I've learned now that if I do talk about it, that I will be listened to and I'll be valued. So I'm going to do it again. And that's what we need to kind of do. But men as well that are bad at it. And I'm just as guilty that you'll have that experience. You'll go for a nice walk with Ian and then say, thanks, mate, all sorted. Don't need to worry about me anymore. That's got to change. We've got to recognise that it's an ongoing process. It's something that needs to be managed lifelong. And I'm a big believer that women prepare for that so much better from a younger age. Sometimes what you have to do is vocalise it, be listened to, get maybe some thoughts or some pointers of what you could do. We need to take more of that, but not expect men to behave in the same way. One thing that we're really keen to do with the 12th Man is to find the way that works for them, and not to try and invest all our resources in making people change, which is not going to happen. Men wear lycra and get on bikes. We'll put our campaign there. We need to kind of, try and promote the fact that it's okay to have low mood, for example. That's perfectly natural. But it doesn't mean disaster. It doesn't mean crisis and things like that, you know.
So cultivating that team culture within our male workforce. I'm thinking specifically at this point about our male clinicians. So obviously we have a lot of other men who work in NCH&C in sort of support services roles, but just for a moment, specifically thinking about our male clinicians who are very busy, out on the road, community nursing, that kind of thing. What can they do potentially to tackle these conversations if they did feel like they wanted to talk, but they're out quite alone most of the day?
The first thing, particularly with clinicians and specifically male clinicians, is that part of everyone's professional practice is reflection. If you can do that in your professional life, to think about what's going on, think about what you have to do and how you might do things differently, it's just lifting that principle of reflection and put that light onto your kind of personal life, and to reflect that, am I okay? Am I doing kind of what I need to do? The questions that you would ask in your professional kind of capacity. And I think if the answer is, well, I could be better, I could be doing things differently, most people will have, even in this kind of virtual world where we're not having so much face-to-face contact, has someone they work with where they've built up a relationship. Because a lot of people work in these services and teams for a number of years, and they don't often change particularly regularly. So you may not have a history of kind of speaking to that person, but it's about a bit of risk compared to what the other risks are. It's tiny to have that conversation with someone. Just like Nick says, it's about embedding it, giving people that kind of confidence. And if you haven't got that person, you've got a line manager, there are well-being resources, and I know they are very good. I've been very impressed with what NCH&C have done in terms of well-being, not just because of those increased risks around kind of COVID and everything that's happened over the last 16, 17 months, and your mental health first aiders. So that really now, I think, as an organisation, there's a real menu, and it's a growing menu of options for men to access. If you haven't got that relationship at work, there are a number of other ways of doing it. And I think that the more we do this, the more we embed this kind of way of working, and we embed that mental health first aid practice across the organisation, I think the easier it will become.
So finally, at the end of every podcast, we ask all our guests to answer this question. What should we try and take a moment to do?
Take a moment to look after your kind of physical health and well-being, because that is intrinsically linked to your mental and your emotional well-being. You might be someone who does a lot already, but if you're not, if you're somebody who doesn't tend to, the difference, a 20-minute walk or going to a swimming pool or getting on a bike, if you've got a bike in the garage that's not being used, 20 minutes, physical exercise, call a friend, do it with them, get somebody else involved. It's like you're more likely to do it again if you make that commitment with somebody else to do something on a regular basis. But I think that benefit of a little bit of gentle exercise that might turn into something more over time, to me, would be a really good starting point to take a moment to do.
Well, that leads very nicely, because I would say that whilst you're taking that moment to do a bit of physical exercise, use that time to just think about your mental health. When was the last time you had a conversation with somebody about your mental health or theirs? When was the last time you felt low? And did you recognise that? And would you recognise depression if it happened to you? How would you kind of recognise that? I myself, as someone who's worked for 15 years in mental health, it took me about 10 years to get to the point where I would recognise that, no, I am feeling depressed at the moment. It's not this thing that happens to other people that I work with. It happens to all of us. That's perfectly okay. It's about what happens after that. So I'd, in a nutshell, take a moment to ask yourself, how are you really feeling at the moment? And if you're not feeling okay, what are you going to do?
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels. For more information on the 12th Man campaign, visit their website 12th-man.org.uk. That's 12th-man.org.uk.